What is the number one diagnosis that I see being discharged from hospice services? That would have to be any form of dementia. So, vascular dementia, Alzheimer's disease, Lewy body dementia, frontotemporal dementia, Parkinson's disease. The disease progression of any form of dementia oftentimes looks like this. They sort of start up here, their health is doing okay, they plateau for a while, everything seems the same, and then something happens. They have a fall, or they have a hospitalization, or they have an infection, something happens, and all of a sudden their health drops off. And they might slowly kind of creep back up their health wise, but it's never going to go back up to their previous baseline. And then again, something else will happen, and all of a sudden they'll drop again. They might go up a little bit. And that plateau and that slight improvement can even continue when someone starts hospice care. In order for someone with dementia to stay on hospice, we have to sometimes look for the smallest changes in their health, even if it's so minimal. And sometimes it's really hard for the primary caregiver who is in the house 24/7 to even notice some of those minuscule decline in health changes. Because if that person with dementia plateaus for a long enough period of time, the hospice team may have to discharge them from hospice because they're not meeting Medicare guidelines. Maybe they skipped a meal. Maybe they're eating slightly less than they did a month ago or 2 months ago. Maybe they have the smallest bit of weight loss. Maybe they're sleeping the slightest bit longer. So look out for those small changes and let that hospice nurse know when they're coming out for every visit. My name is Katie Duncan. I'm a nurse practitioner and an end-of-life coach. Follow me for more end-of-life education.